loud. Okay, and then we do the live transcript, which is meh, meh. And here we go. All right. 3, 2, 1. This is the way it rolls. Hi, I'm Shivan Sarna, founder of SIBO SOS and the creator of about 9 summits now, just in the middle of the Fascia and Chronic Pain Rescue Summit with tens of thousands of people attending. It's really exciting to have that expansion. This is my book, Healing SIBO. Get it? You will learn everything I wish I had known 5 years ago. And one of the people that has been so instrumental in helping me as well as this community is Dr. Ken Brown. He's with me today. He's a gastroenterologist who is, I call him the outside of the box thinker. He is also the creator of Atrantil. And he's going to talk to us about hydrogen sulfide, the microbiome, SIBO, IMO, and that's IBS as well. And he's just back with new breakthrough information about the microbiome from a big conference. Hi, Dr. Brown.
Shivan, how are you? It's so great to be back. And once again, thank you for being one of the people that just keeps driving it forward and bringing new information. I think I watched Dr. Pimentel's Drop the Mic study where he went first to you and then he published. So it's coming on your show first to show your audience. And I'm trying to do the exact same thing. I got some stuff that's pending publication that I just learned at the American College of Gastroenterology. And what better place than to do it? You heard it first here on Shivan's one of her summits. You know, I've gotten, but before it was always just SIBO SOS, and now I see that there's the chronic conditions and all these other things you're getting into. And so I commend you so much for just continuing to bring this information to everybody and having people on that have different insights. And it's fun because all these things are moving targets. And the one really cool thing that I saw at the American College of Gastroenterology is that we're starting to have this thought process that maybe we need more out there, and maybe natural things are some of the things that we need to do, and lifestyle modifications, and not always just a pharmaceutical option. So it's making a difference.
It is making a difference. And yes, it is. And also by just popular demand. By the way, I wish Dr. Pimentel dropped all the information on me before it got published. He always says, I'll tell you that after it gets published. So anyway, he's very generous with his time, information, and energy. So we love him. And we have another time scheduled with him. So it's really cool. But
I had to run to the ACG, and I only had one day to do it because I had to go because of one particular presentation. And I was hoping to see him because I wanted to ask him a few things about some other, and we can actually get into that a little bit about his paper, because I have a quick little presentation I would like your audience to hear.
Go ahead and start.
That would kind of play into that. But that's anyway. So that was the thing, is that I was hoping to bump into him. I didn't bump into him, but I would look like a stalker, I guess, if I sat there and ran up to him.
Fangirl right here, fangirl. So Dr. Brown, go ahead and share your screen, if you will, and we will see your presentation. And so this is the big, so there's Digestive Disease Week, which is the biggest gastroenterology conference in the world, I think, with people from all over the world. And then this is it's AG. I always get it mixed up with the GEMS show.
It's ACG. So it's American College of Gastroenterology. Right. And the way that we think about it is that DDW is the international, what could be someday conference.
Yeah.
ACG is a little bit more the people that are in the grind. This is what's happening right now. So you go to practice management seminars, you have your experts go, this is how you treat IBD. This is what we're doing at our center. Try and implement it at yours. It's a much more practical, or I guess it's much more for the clinician, the gastroenterology clinician that goes there. DDW is for the international researchers and things like that.
Awesome.
Both great in their own regard.
Definitely.
And there was a period in my career when I was doing a lot of research where DDW was more relevant. Then I got really into ACG, doing practice management and things like that. And so they're all important for different reasons.
Very good. Okay. Do you need permission to share the screen, or
you know what? Let's check. So basically, everyone, I put a little PowerPoint together because there's a couple of interesting things that are both new. And then in the context of what Dr. Pimentel showed with some new stool studies in relation to IMO and SIBO, I've been working with some scientists, so I've been very, very fortunate right now that because of Atrantil and the circles that I'm running in now, I'm sort of sitting in a bunch of different little circles. I've got areas where I'm working with researchers that are doing bench research. We've got clinicians that are doing clinical research. And this is the path that it's going. It's very exciting because it comes down to the gut. This is what happens. So this is what I would consider my what is new and what is technically old little presentation here. Hopefully it's okay. Let's try this. Is that the other screen right there? Do we need that?
No, I don't know. Just share your screen.
Okay.
Is it? Yep.
We'll share the screen.
Okay. Very good.
Are we good? Can you see what's happening?
Yeah, we're good. I'm going to hide myself so we can just focus on you and the screen. And then if I have some burning question, I might interrupt.
No, you don't have to hide. Just go ahead and interrupt at any time here. But so this I titled, and forgive me because it's this just happened. So we're putting this together in pretty quick little fashion here. And like I just mentioned before, that coming on Shivan's various shows now are the place to sort of drop this kind of thing. So this is, I titled it, What's New and Old in Digestive Health, SIBO and IMO. And of course, we want to thank our hostess here, Shivan Sarna. And when I pulled this up, the reason why I said that is I did not realize that you are doing all these things. And I want to, once again, thank you for helping all these people out. And you're developing these different rescue webinars using science, getting it out there, making it accessible for everyone. So this is very exciting and I'm very honored to be here. And I want to talk about what is new here. So one of the things that is new and very exciting for us, I was just in the American College of Gastroenterology, and today's date is the 27th of October. And I was just at the ACG on Monday because there was a presentation being done, poster presentation, with the effect of an herbal supplementation on intestinal methanogenic overgrowth. And I want to point somebody out here. Every time I touch the screen, it makes it seem like I'm off. That author right there is Darren Brenner. Super cool guy, has been published a tremendous amount of times. I did meet Joy Liu, who was his former fellow that is now an assistant professor at Northwestern. Very exciting because they took it upon themselves to do a study on Atrantil. They wanted to see if Atrantil, of course, Atrantil being quebracho, horse chestnut, and peppermint, they put oil, but it's actually peppermint leaf to access the polyphenols, is associated with symptom reduction in individuals with IMO, determine if Atrantil is associated with reduction of breath methane levels, and determine if there is a correlation between symptom improvement and reduction in breath methane levels. So what they did is they took patients that had positive glucose or lactulose breath tests that showed a methane level greater than 10 parts per million. They were recruited from one center, Northwestern, but not one doctor. So many people in the gastroenterology department could refer people to this, and participants consumed 2 capsules of Atrantil 3 times a day for 4 weeks. They used something called a PROMIS GI symptom questionnaire. And I admire them for doing this because what that means is that they had the patients basically come in that could have any number of symptoms. So the PROMIS scoring system starts out with the domain of GI symptoms, quite broad, then subdomain of all these different symptoms: belly pain, bloat, gas, diarrhea, constipation, bowel. It covers everything: heartburn, swallowing trouble, nausea, vomiting. And then a further, you think of it like a species of the facets. They differentiated the bloating and abdominal pain. And Darren explained to me, he goes, the reason why we really wanted to do this is because as clinicians, remember when I said that DDW is the forward-thinking one, ACG is there to try and help doctors handle their patients. As clinicians, these are the things that get the doctors very frustrated. We need something for bloating and pain. So they use this particular score, which should be used more often if you're talking about a broad symptom base to try and help people. And they had the statistical analysis of how to do that. These are all actually from the presentation. These are copy and paste. So hopefully it's going to be published soon. So what we're looking at here is that 42 individuals were recruited and 39 actually completed the study. 12.2% were clinically diagnosed with IBS. This is really interesting because remember, these are being referred by other doctors that they just came into the clinic with one of those GI symptoms. They got a breath test on them and said, well, you're this, go over to my buddy, Dr. Brenner, and you're being diagnosed with this. Only 12.2%, which once again gets back to the whole thing of what qualifies as IBS, what is SIBO, and so on. The baseline indications for the breath testing included bloating, constipation, pain, and discomfort. So if people went into any doctor and said, I have one of these symptoms, doctors are now ordering breath tests. I point this out because 3 years ago, I don't think one of my colleagues was ordering a breath test. So at least now multiple doctors are starting to do this. And then regarding the effects of Atrantil on symptoms, what they showed is statistically significant improvements in belly pain, gas, bloating, constipation, swallowing, and nausea and vomiting. What I like about that is I have so many patients that come in with SIBO-like symptoms, and they come with a pre-diagnosis of gastroparesis, or basically their stomach doesn't empty very well. And what we have found is that people that have SIBO can actually experience nausea and vomiting because it sends a signal to the stomach to not empty. And I personally would not have used that PROMIS sort of scoring, and I'm going to start using that kind of scoring more if I were to do more studies, and we'll get into that. What they did show is that ultimately point estimate improvements in belly pain and gas and bloating suggest a very clinically meaningful improvement in over 56% of the subjects reporting adequate relief.
Wow.
One of the things, what's that?
I'm saying, wow. That's amazing.
Yeah, and we're going to talk about these results in a second, because when you look at it, if you don't understand when you're looking at clinical trials, and we'll go into that in a second here, but those results are pretty astounding, considering that I did clinical trials on Xifaxan and Trulance and Linzess, and the FDA was giving approval for a lot of these medications if they were 6% better than the baseline. So we're 56%. Now, the effect of Atrantil on methane levels. This caught me a little off guard, but then I can sit there and think about it and go, actually, this makes it very fun now. 86% of the breath tests actually persisted positive IMO post-treatment, but there was a consistent decrease in it from 30 down to 26, but an extremely weak association between overall reduction of methane and adequate relief. What that means is that somebody doesn't show up to the clinic and say, I have methane. They say, I have bloating and abdominal pain. Atrantil was able to decrease it. But in the IMO patients, in the people with methane, they had significant improvement in their symptoms, a decrease in the methane, but not necessarily to the levels that we have seen before, which is exciting from a science standpoint. And I keep saying we'll talk about it in a second. So I get excited. Obviously, it's my baby. They did a study without us being involved at all. It was just fun to go there and watch this being presented at a national conference that happens to be presented by one of the most prestigious universities in the country that has one of the more robust GI departments. So basically, the conclusion was at 4 weeks, the most robust symptom improvements were belly pain, gas, bloating, and constipation, consistent with the presumed effects of Atrantil in patients with IMO. There was adequate relief, was endorsed by greater than 50% of individuals taking Atrantil. These changes were not significantly correlated with methane levels. Atrantil may be an effective natural treatment for symptoms of IMO. So why is this exciting for me? First of all, I had a long talk with Dr. Brenner, and his enthusiasm was amazing. We had about an hour-and-a-half conversation. And, I'm over here wanting 100% on everything. I want 100% of the patients to get better. I want 100% of the IMO to be reduced and all this stuff. And he said, you don't get it. He's like, this is way better than any pharmaceutical agent that we have ever seen. And it's natural. Then we didn't have any side effects. He's like, this is unheard of. So the other thing you have to keep in mind, and I did interview the presenter herself, and she said, what's really exciting is it was this very heterogeneous group of people, meaning that as long as they had some symptom and somebody ordered something on them, we just threw them in there, gave them Atrantil, sent them home, had them fill out some questions and come back. So the participants really had no understanding about the true mechanism or the long-term benefits of Atrantil. They got excited at the fact that they had that kind of response. In my own clinic, and I'm sure, Shivan, when you recommend it for your clients, there's a much better response because you're handpicking the people that you think should get it. And also you can explain to them through means like this of why it is beneficial for you. And the methane did not correlate with symptoms. And so this really means that we need some sort of large, full placebo-controlled trial. Keep in mind that as somebody who has a product, they used the trade name on it. Very few natural products have ever had a trial like this done. In fact, to my knowledge, none, because all the ingredients that are usually used in these things would be the generic ingredient. What we're doing is a proprietary blend of 3 ingredients: quebracho, chestnut, peppermint, together resulting in this. And so it's a very exciting time, and they want to pursue a full-on large trial. We could potentially be the first natural product by name that would have the ability to have a placebo-controlled trial. And quite honestly, very confident that we could end up with kind of similar results, which would be a game changer, a complete game changer. Now, what we're talking about, the methane levels, I know that there's so much movement around this. And with you having people on and having these experts, Dr. Seebecker and Satish Rao and Mark Pimentel, and the list goes on and on. What I love is that I walked around and I listened to different presentations, and there is all different kinds of stuff going on with different SIBO presentations. So this was done out of Houston Methodist. It was Eamon Quigley, who's the godfather of probiotics. And they did this thing where they looked at 390 patients, 174 of them actually were SIBO positive. They went through a retrospective study. They looked at everything. Their conclusion is symptoms are poorly predictive of the presence of SIBO as defined by the breath test. Symptoms are also poorly predictive of the response to antibiotic therapy. Retrospective study, just another thing where you go, okay, we're still, what I love is now we're getting more institutions involved. We're getting more scientists that are starting to realize, hey, this is a real thing. We got to start looking at this. I bring up the methane because this particular presentation was about how maybe the breath tests are not black and white. And then there was this presentation, the use of postprandial breath hydrogen to monitor antibiotic-induced changes of the gut microbiome. Basically, what they were looking at is people that you think might have SIBO. They did a postprandial breath test on them, and if the hydrogen rose, they wanted to see if it went down with antibiotic treatment. Antibiotic treatment was not defined. And many times the breath test went up during the treatment, which is interesting. And so their conclusion was that the postprandial hydrogen data may identify those who produce elevated gas levels due to dysbiosis and provide objective data to help guide antibiotic treatment protocols. These people are your friends Angus and Claire, who you had on one of the series, I believe. The old food marvel, yeah. So we hung out with them, great people, and it's very exciting to be in this space, meeting technology people, being with scientists who are looking at this. And so we're trying to do our part also. So KBMD Health is me and Eric's brand with the podcast, where it's almost like our research. It's like our research lab where we get to figure stuff out, test different things, and then go back to KBS. Like this is where we ended up. We just launched Atrantil Pro, whole separate show. But so we're gonna do this, and I'm really excited about this because we teamed up with Zymogen and the Whole Scripts people.
Yeah.
And they're going to do this. And this will be ready in about a week. We've been working a little bit with this. We're going to do a delivered box to people's homes. And I'm going to call this the SIBO box. This is the KBMD Health. Yeah. Your health has arrived. And what it is they're going to pre-package. So you're going to have Atrantil. And this is my theory. And the beauty is I'm going to be able to communicate with my patients that are on this. We're going to send questionnaires. We're going to get this so we can turn it into a presentation at one of these. You're going to get an AM and PM dosing of Atrantil, and some people that we've had on our podcast have enlightened me that I'm probably missing the histamine aspect of it.
Sure.
So it's going to be Atrantil, HIS-DAO, and an immunoglobulin. And looking at that, IgY, because of some different reasons why it's more stable in the stomach and in the small bowel, we're going to see if that helps. I believe if we're getting, let's just say that's the worst that we're going to get is 56%. Somewhere in here, a natural combination is just going to maybe be a game changer. So we're going to launch this next week, and we may be able to find out, okay, I'm having better results with this. And this just comes to another thing where everybody's just sharing. So people are going to get this to their homes. It's going to be prepackaged, easier than you can do. You don't have to worry about it. Grab one off, throw it in your purse, put it in your pocket, and you'll take your PM dose. And we're going to do symptom scores afterwards. So very exciting to be in a position where hopefully we all continue to help each other and improve the landscape.
That is fantastic. Listen, before you guys have a million questions about this, we do have a great buy on Atrantil, the single bottle or multiple bottles, but without the little cute packaging there, with the other supplements. And Clarissa will put that information in the chat for you. And Ken, if people want to get this, how do they do that? Do they have to be your patient? Because we're going to get besieged with customers.
Just go to kbmdhealth.com.
Okay.
But this is it's a
big deal.
Well, it is, but it's this is going to be something that's super exciting. It's also very pricey. So I want people to realize that this is for the person that's very motivated. It's going to be, specialized, personalized. It's going to be an individual packet. So if it's going to be a little price prohibitive, I don't really know what it's going to be right now, but it's a lot of work that we're putting into it. So
it's an alpha testing. So, and then you'll be in beta and all that jazz. So, this box will, basically what I'm saying is I prefer that people go to your site right now as we're working the kinks out. And so, but you are more than welcome to give us your information so that we can have it on list. And if we're starting to crush it, we'll sit there and put it out. We're going to try and make it cost affordable. This is not like a profit move, but as we get more into these business aspects and you start doing the stuff, you're like, eesh, this just keeps, you know how it is. It's everybody has a business. And so it is there, but yes, just go to kbmdhealth.com, sign up the newsletter, and then we'll get it out there when this thing's ready. Awesome. And in the meanwhile, get your Atrantil at up to 33% off.
You're not going to find it any place cheaper than what you're getting from Shivan. We know it well. We have meetings all the time where it's just like you see where your profit margins are. Atrantil is still a business, and we still want to make sure that people like you get the best rate because you share the knowledge. That's sort of our philosophy.
I really appreciate that so much. But let's also talk about Food Marble. Food Marble, we have a whole set of webinars we've done with them. And so Clarissa, if you could pop the Food Marble link in there too, in case anybody's like, what is that? It's a personal breath device, breath testing device. There's more to it than that, so I don't want to oversimplify it. And so, but we have 16% off of that. I gave them an extra percent so I could say the lowest price anywhere. So we'll pop that information into the chat as well.
So what's so exciting about Food Marble, and we hung out quite a bit with them in Charlotte. Yeah,
they're great.
They're telling me, and they're showing me data. They're like, hey, when people take Atrantil, their methane drops. So we've got a methane at the beginning of a study, methane at the end, and it's there. But what's going on in the middle? Much like a blood pressure, much like a continuous glucose monitor, what's going on? And we're going to learn more about that. And that's going to be really exciting. So
that's great analysis.
I'm trying to get some of my patients on the Food Marble so that I can watch that and say, just please, whenever you take Atrantil, just log it as a thing so that we can see. And it's strictly data that we're trying to figure out here and go, okay, listen, we learned something recently. We have this trend where people with diabetes, when they use their Food Marble, we've noticed that the delay is a little bit more. That makes sense because you may have gastroparesis. It's all data points to fine-tune treatment. That's where I would like to see it go.
I That's awesome. Please put your questions in the Q&A box. I didn't mention that earlier, but I would like you to put them in the Q&A box. It will help me manage them much more effectively. And the chat is just for tech issues because it gets super distracting. So thank you. Sorry, I didn't mention it earlier. That's bad on me. Ken, do you have more slides?
I do. So now I'm going to take a quick, what'll seem like a 180 turn, but it has become my newest passion because of the people that we're working with. Okay.
Okay, go.
So bear with me if it doesn't seem like it fits, it kind of does, because this has become my massively transformative goal.
Oh gosh.
With everything that we're doing. And I want to cure dementia.
Oh, great.
It has occurred to me that it is what I see with my patients, the gut health really determines the brain health and the long-term effect of this. This kind of hit me. I mean, I've always been very passionate about this, and we're working with scientists, but my son and wife went out of town. I worked so the whole family could play tennis, and my mom was in Nebraska, and I was like, hey, we got the weekend free. Can you hop on a plane in 3 hours and just come and visit me and Carla? That's my daughter, Carla. Visit me and Carla, and so that we can hang out this weekend because Lloyd and Lucas are out. And she's like, yes, of course. Yeah. Okay. It's in 3 hours. So mind you, here's the kicker. She's 83 years old. So it didn't even, we sat and she came and she visited, and I'm like, wait a minute. My mom has this great memory. It's everything. And she was talking about her friends that are in nursing homes that don't remember anything and all this other stuff. And so I was like, wow, this is, she's doing something right. And what does she do? What? Everything that I've learned like this whole time, my whole career, it's like, Mom, it's about socialization. Mom, it's about this. And yes, since day one, when we launched Atrantil, and you'll see why those polyphenols are important, I think that it's making a difference. And I really think that she's sharper, physically more active than she was when she was in her 70s. So it makes me look like a great son, but I do have to at least, I have to disclose that I'm not that nice of a guy. This is my mom. First thing I did is put her on the Oculus Quest and threw her in the ring and made her.
Oh my gosh, how adorable.
Made her box somebody. So she's 83.
Honey, 83, that's no joke. I mean, I know 30-year-olds who can't get on an airplane with 3 hours notice, okay?
3 hours notice. And that's what she was telling me. She was like, she's like, I do everything you say. This should be your new thing. And that became my massively transformative goal. So then this kind of gets into this, what are we actually doing? Is this lifespan? Is this health span? Is this whatever? There's all these fantastic people looking at this. David Sinclair, Peter Attia, Rhonda Patrick, people that everybody knows. And they all talk about the recurring themes on this. Everything in anti-aging right here is this cellular stuff, calorie restriction, mTOR pathway, sirtuin pathway, AMPK, IGF-1, all this stuff. When you read their books, and I've read David Sinclair and listened to that, all fascinating, tremendous. They're missing something. Nobody's talking about the microbiome.
Thank you.
Nobody's discussing this in an anti-aging phenomenon. And aging, it's basically, this should be super easy. It's microbiome. It's my space. Well, you have the microbiome. Let's just, hope that it's all in the right place, not in a SIBO situation. The microbiome talks to the brain, talks to the immune system. That's it. No, unfortunately, or fortunately, the brain talks to the microbiome, talks to the immune system. Immune system goes back to the brain. Immune system goes back to the microbiome. So it's this much more complex and nuanced thing. And we use the term all the time, but what I tell my patients is, I say microbiome, and most people are like, I know what that is. Basically, you have 100 trillion microbiota, which is the bacteria, and they have genes. They have 150-fold more genes than we do. So Shivan, you and I are 99% identical in our genes, but our microbiomes might be 80 to 90% different. That could explain why people respond so differently, or why people have different effects in their life. So what we do know about the microbiota, meaning what we do about the organisms, is there's over 2,000 species, 12 different phyla, and the vast majority are related to about 4 different phyla. This is this super complex breakdown of this, that if you're a microbiologist, this is what's getting into. And when Dr. Pimentel discussed his stuff with you, this is where the organisms he was talking about that donate the hydrogen for either methane or hydrogen sulfide are buried in this particular graph. but I need to make everything simple. I'm just a simple country butt doctor living in Texas. So in my, everything comes down to this: age-related changes of the gut microbiota. Basically, you have more of what we're going to call good bacteria. And as we age, you lose those good bacteria and you have more bad. That means that your microbial diversity decreases. So just that one phenomenon is basically aging. Aging causes changes throughout the body. As our microbiome gets older, we get older. So the diversity shifts from being, a huge diversity to very narrow. And the most powerful shift happens from age 60 on. Here's
Really?
the thing. Yeah, but here's the kicker that Dr. Brenner and I talked about, where he went, whoa. And this is why when I was talking about the Atron-Thiel study that they didn't discuss any of this. So if this was discussed with somebody that was coming in that study, then they would go, well, wait a minute. So the side effect is possibly having more bacterial metabolites, having more, diversity. Everything is the metabolites now. So a lot of the researchers are looking at what happens when you have these metabolites. It's these metabolites that lead to better health. So this is from, I love it. Hold on. Let me see if I can get this. One of the Zoom things is blocking my whole top line. So I'm having to guess what the title of everything is.
No, you just move the box over.
Yeah. So this is from an article which actually looked at in gut microbes. It was in 2021. All these articles are extremely new and relevant. Effective aging intervention. Bottom line is, you look at this, and in flies and in mice and in rats and in humans, as we age, the microbial diversity decreases and the pathogenic bacteria increase, the good bacteria decrease, except in one particular group. And that group is our centenarians. Looking across at people that make it past the age of 90, if they do stool analysis on them, they have more beneficial bacteria, specifically Akkermansia or Akkermansia. So the question is, does the diversity allow you to live that long, or so on? This was an article that came out of Allergy and Immunology. This one is here. It was in 2021 because they looked specifically at that organism. These guys in the allergy world went, wait a minute. Allergy and immunology, it seems like our patients that have more of this particular species, Akkermansia, seem to do better. And there's reasons for it, which include gut barrier integrity, improved immune response. And Akkermansia is a prolific butyrate producer. Butyrate being a short-chain fatty acid. Butyrate and short-chain fatty acids are one of the many metabolites that a bacteria can do. So everyone knows about butyrate, much like everyone knows the lead singer of Maroon 5, but there's actually many short-chain fatty acids. So Adam Levine would be butyrate, and then all the other people that I don't even know their names are valerate, acetate, propionate, and isovalerate. Eric and I just did a podcast not too long ago about how IPA3, which is indole propionic acid 3, does some interesting things. So as researchers are looking at these other things, maybe butyrate isn't the only one, but just producing all these short chain fatty acids work together. And what butyrate does is it actually works to improve the gut, improve the immune system, and it crosses the blood-brain barrier to decrease inflammation in the brain. So when we're looking at this, we think of the ability to not produce butyrate could be related to dysbiosis. We talk about dysbiosis in SIBO, but it could be dysbiosis in the colon also. Dysbiosis in SIBO would be that it's just you have bacteria growing where it shouldn't. And the colon, if you don't treat your microbiome well, you just have more bad than good. In the most simplistic way, that's what dysbiosis. But we know if you have dysbiosis, either in SIBO, IMO, or direct dysbiosis with a narrow microbial aspect leads to inflammation. This inflammation is the key to everything. And you know this because you're doing all of your other summits and things. If you look at what you're doing, everything that you're looking at and the things that you're trying to tackle ultimately come down to inflammation. Inflammation sets off everything else. So if you have inflammation, this is where we have the link to the immune system. This is where we have the link to the CNS. So much so that the term inflammaging is what's being used by a lot of these researchers.
Oh, that's
You
cool.
you don't age if you don't have inflammation. So trying to protect your body from this inflammatory response is the key. So my massively transformative goal is to protect the brain, because I know that a lot of the brain damage happens in the gut. And that's why I think that we can stand a chance. Now, this was just published April 25th, 2022, the gut microbiome as a modulator of healthy aging. This is in one of my gastroenterology and hepatology journals. I got excited because these guys, meaning other gastroenterologists, are start to realize this is what's going on. These are just different diseases that have been linked directly to dysbiosis. Lots of them. Wow. Everything from weight gain to frailty to cardiovascular disease. And so when we look at this, the incidence of gut dysbiosis increases with age. However, it's a little bit unclear whether dysbiosis causes immune dysregulation or the aging immune system causes dysbiosis. We have ourselves a little, chicken and the egg kind of thing going on. So if we have this going on, then we have to continue to look at some of the literature that's out there. This one is one of the, and I say older, this is 2016. I put this in here just to show that super, super smart people. I think this was a joint study between Stanford and Harvard, or just ridiculously smart people, linking the human gut microbiome to inflammatory cytokine production capacity. So this is a graph. Just take away from this that what they did is they looked at different inflammatory markers in these different people. They took 500 healthy adults. They looked at stool samples and blood samples. They saw how much inflammatory markers they were. And then they looked at their stool, and then they did this crazy analysis, which I love that there are other beautiful humans this smart to do this kind of stuff. Yeah. But this is how my brain interprets this. It's just basically the results are, a good result is you have a very controlled immune response, which showed the people that had great, remember, it was 500 people. They just said, what's your inflammatory markers? What's your stool look like? What they showed is those people that had elevated metabolites over and over and over again, those that had increased butyrate, those that had increased propionate, had very little immune markers that were elevated. Those people that did not have those metabolites, meaning they had dysbiosis, had elevated interleukin-6, TNF-alpha, interleukin-22, interferon gamma. Those are inflammatory markers that create chronic disease. Wow. So their conclusion was that individual variation in cytokine response is actually linked to the microbial organisms that are with you. This observation suggests that modulation of host defense by the microbiota may be exerted mainly through the release of metabolites. So at this point, you're probably like, okay, well, what does this actually have to do with all of this? These are one of the scientists that we're working with. Study of antioxidant capacity and metabolization of quebracho and chestnut tannins through in vitro gastrointestinal digestion and fermentation. This is the lovely Sylvia Molino, PhD. She helped us, or she's helping us further our research in Atrantil. You will notice that quebracho and chestnut are in Atrantil. So these are articles that she's working on that we're privy to, that one right there. So her PhD is in these tannins. These are studies that she did. And it's so exciting to talk to people who are in the space, like Dr. Brenner, where he was like, that's nuts. You're kidding me. I'm like, no, dead serious. We have the data. What she did is she looked at quebracho and chestnut, and she put them together, and she put them through an in vitro digestion phase. I believe that you've had Dr. Krishnan on several times, Kieran.
Oh, Kieran Krishnan, of course. Yeah.
So they use something similar where they call their SHINE digestive process, where they test their spore biotics in that. That is an in vitro way to do it. This is another in vitro way to do it, where basically they took it, they did the quebracho and the chestnut, they put it through the digestive process, and then ultimately they fermented it. And she fermented it with like a fecal microbial mix of humans and just a smattering of humans of a very realistic thing. This is something that nobody really has ever seen before. Basically, the quebracho and the chestnut, when it's metabolized by the bacteria, meaning the polyphenols are fuel for the bacteria. Quebracho is one of the largest, most stable polyphenols, known as a tannin. And when the chestnut and the quebracho get broken up by the bacteria, because they use it as food, they start kicking off smaller molecules. Those smaller molecules are things that people recognize, and they go out and they buy separately. For instance, the procyanidin B1 is the polyphenol in blueberries. Epicatechin gallate is green tea extract. Urolithin A, urolithin B, which are well known to help with cancer, ellagic acid, and quercetin. So the exciting thing is that Mother Nature has these large, stable polyphenols that then can be broken down into smaller phenolic compounds. And then once they're smaller, the rest of the microbiome can actually help break them down. And then looking at this, what she did is she showed the amount of metabolites being produced. This right here are the short chain fatty acids. And what you will see, the white is not a control. The white is inulin. That is the gold standard that everybody says that is the prebiotic that helps feed your bacteria the most. What we're learning is that polyphenols produce much more metabolites than just a straight fiber like inulin. So the total short chain fatty acids combined are markedly better, including the butyrate. So,
and you aren't going to have symptoms.
And you're not going to have symptoms. Yeah.
Right.
So,
the negative symptoms of inulin for people with gut fermentation issues often is not a good thing.
Correct. So yeah. So the people that are trying to improve their microbiome. Yeah. So this, I'm glad that's a very great segue, because this slide, this is what I run into. Is a diet actually healthy if you don't have the right microbiome? Meaning I have all these people that show up on January 2nd and they say, okay, I've been eating like crap my entire life. I've switched my diet and I feel miserable. And basically what I tell them is, well, if you've been eating McDonald's your entire life, you don't have the microbiome ready to take this on. In other words, you need the right key to unlock the potential of the healthy diet. So basically, if you're taking supplements and you're trying to eat right, if you do not have microbial diversity, you may not be getting the full benefit from it. So the polyphenols feed the bacteria, and the bacteria are the key to unlock the benefits of the polyphenols. This is a study that came out of the Archives of Gerontology, and they looked at diversity of the gut microbiome related to cognitive behavioral outcomes in healthy adults. So what they did is they had 63 adults aged 67 to 83. They took stool samples and then they put them through these different electrophysiological assessments of brain potentials. Basically, they made them do stuff and they monitored their brain activity. Across the board, the lower the microbial diversity, the poorer the cognitive scoring. So their conclusion was, it is of significant relevance that we were able to show that a decline in cognitive abilities can be predicted by gut microbiome composition. These are neurologists doing studies now, looking at the gut microbiome. And then this one is really interesting because this is looking at another one. This one just got published in February 2022. It's enhancing the cognitive effects of flavonoids. Flavonoids are slightly smaller polyphenols than the tannin. So flavonoids, many flavonoids put together equal quebracho. And so what they showed was, this is really cool. If you eat polyphenols and they're in your system, then you go out and exercise, you get more metabolites. You increase the metabolic effect of this. Getting back to the idea of what do you do to lead a healthy life? Then what they showed is you get more metabolites, and it improved cognitive function across the board for those people that even ate the flavonoids and they didn't exercise. So my recommendation is take Atrantil, make sure you exercise. So ultimately, we all need the right fuel. This is just a representation for it. You need the microbiome, which is the vehicle, and you need the fuel for it to work. And this is a case of a right fuel, bad microbiome. So we've got a big diesel truck and trying to put in some Tesla energy. And then this is a case of great microbiome, wrong fuel. So you've lived in the Mediterranean area your whole life. You come over here and start eating McDonald's, bad move. So it ultimately comes down right fuel, right vehicle. You need the right microbiome. So lifestyle is maintenance, and you got to do the basics. Everyone knows it. Exercise, sleep, fasting, socialization, super huge. A community like you develop, Shivan, interacting. If who's ever on here and listening to this, engage, email her. Whenever
in the Facebook group, 25,000 people are in there.
In the Facebook group, even if it doesn't feel like it, you're socializing right there. You're talking, you're doing it. It's super important. This is something that my son came up with while I'm clearly very passionate about this. He said, you know, you got to like tell people. So this is what I give to all my patients and all my staff wear it. This is my lovely nurse, or a lovely nurse, Riley.
Riley.
Yeah. And so she's wearing this bracelet that this goes to strictly credit to my son, Lucas. He goes, yeah, just put WWYMS. I'm like, what does that mean? He's
what
like,
would your mother say?
What would your microbiome say?
So good.
Yeah. Next time you're sitting there and it's, you know, you're in line at McDonald's. And so this is what I tell my patients. I'm like, if you're ever in line at McDonald's, look down at your wrist and pull out and go someplace else. Stress affects it also. So if you have a spouse and you're arguing with your spouse, point at your wrist, go, hey, just chill out. You're messing with my microbiome a little bit here. Make you got to sleep. So take home points on this end. So the first part was just the new, this is why I call it the old thing. Don't let your microbiome get old or you'll get old. Feed your microbiome what it wants. It appears that polyphenols are superior to fibers. The larger, the more stable the polyphenol, the more metabolites you will have, which is Quebracho Colorado. I challenge somebody to find Quebracho Colorado in any other supplement. And if you do, let me know, because they're violating a patent. And without the right combination of fuel and microbial diversity, it's really just an uphill battle. And the metabolites are the real reason for the benefits. And this is all based on science. And that was the quick and dirty on
down and dirty
microbial diversity and what's new in SIBO and IMO. And you still have 10 minutes before you have a hard stop.
Here, I've got something for you. I'm going to go downstairs and deal with something, and then I would love to keep you on for that a little bit of extra time. But can you go into the Q&A and start taking some of those on for me, Ken?
Yeah, so I just read them and
you read them and you answer them. And if we want to get through them, you have to do it fairly quickly.
Yeah, got it. 33%.
Okay. Do you see? No, go to the Q&A box. Q&A.
Not the chats?
Not the chat. We are really good about keeping it in the Q&A.
Oh, got it.
Start with Christopher.
Okay.
All right. I love you. I'll be right back. Oh, okay. You got it? Do you see it?
Yes. Yeah.
Okay,
Got it. I'm sorry.
You gotta read it out loud. I know it's not as easy as it looks. Sorry, you guys, but I want to keep Dr. Brown a little bit longer. In order to do that, I have to go deal with a family situation really fast. I'm going to hide myself and I'll be right back. Go.
Good luck. All right. So Christopher asks, when you treat SIBO IMO, both and after treatment and testing, you come back positive only for hydrogen. Is it recommended to retreat for both so methanogens don't flourish again? That is a great thing. So now we're starting to treat the test instead of your symptoms. So Christopher, when I treat my patients, I will look at a breath test and say, okay, remember that the deal is that if you are bloated and constipated, the chances are that you probably do have some methanogens in there. And if your breath test only comes back positive for hydrogen, that hydrogen is being used by the methanogens. So I treat the symptoms. If you're constipated, bloated, and you're failing stuff, then I treat that. So yes, I would treat both hydrogen and methanogens because that's just a snapshot. That's where something like the food marble really comes in, because they test for hydrogen and methane, and you will see that ratio shift and change. So yes, I would treat that. All right. So Darlene tested positive for methane and hydrogen SIBO last year. I went on a couple of different herbal protocols, and I use the, sorry guys, my contacts are here and I'm actually at the point where I need reading glasses, and now I'm having trouble reading. See if I can grow it. After second test, the levels had lowered, but still there. I'm still in phase 2 of the biphasic diet, still have symptoms. I'm now prescribed Neo and Xifaxan. My naturopath said I could take NAC as a biofilm buster at 600 milligrams. She did not believe in taking, don't know what that is, PHGG to increase the antibiotic effectiveness. I've heard that it is supposed to be helpful. However, does it only help bowel movements, or does it feed bacteria to bring it out more? Okay, so I'm sorry, it's a little bit long and I'm having some trouble reading it, but basically I don't know what PHGG is. I will just make a couple comments on this. So
partially hydrolyzed guar gum.
Oh, okay. That's cool. So that there was a study that came out that said it actually activated Xifaxan more. So Xifaxan is an antibiotic that has to be incorporated into the bacteria to work. The herbals like Atrantil actually have natural effect on the cells of the bacteria. Here's something that I want to talk about. I'm just going to use this, and hopefully if somebody else asked it, we're answering it now. So Darlene, one of the things that I look at when I'm looking at breath tests in people that do not respond, I look at where their breaths are peaking. So if there is like a really early peak, sometimes I think that both the Xifaxan and the neomycin, and quite frankly, Atrantil, may be opening up the capsule after the duodenal sweep, where maybe that's where your bacteria are. An example would be if you have a duodenal diverticulum, then in the duodenal sweep, the capsules come out of the stomach and they're just starting to open up. Ideally, you want them opening up in the small bowel. If conversely, they open up, or let's say you have a spike of methane, but I'm seeing it, I don't know, whatever, before it gets to the colon, and every test is slightly different, but I'm like, wow, that's pretty distal. Then I've had success actually upping the dose of kind of everything. So I'll actually use higher doses of Atrantil. I'll give them extra Quebracho, but I have that capability in my office, but taking higher doses, and then we see some success with that. The other thing is, after looking at that microbiome talk that I just did, we are seeing success as time goes out. What I believe is happening as we change the microbiome, your body produces more butyrate, your body produces more anti-inflammatory things, reestablishes the migrating motor complex. All that being said, now getting back to the biofilm thing, N-acetylcysteine, I love N-acetylcysteine. I don't use it as a biofilm. I use it for a lot of other stuff. But the whole biofilm concept, most of these things actually do disrupt the biofilm. The Quebracho can do that also. I'm not hung up on that so much. I'm shifting my pendulum to, we're going to treat the symptoms and we're going to improve your microbial diversity so that over time it will correct itself. Hope that helps.
That's awesome. Thank you. Okay. Which prokinetics do you like? Catherine Popkin, MD, which pro-motility drugs do you recommend, and how do you decide how long to use them? And do you use them during treatment also? So many people ask this question about, do you use them during treatment?
Well, I personally use them during treatment. And, I've gone, so I kind of follow, Pimentel's recommendations. Initially it was Zelnorm, then, we lost that, then it became erythromycin, and now it's prucalopride, Motegrity. The problem with these is that I can't get the erythromycin that I want. And hey, what's up? Come on in.
Is it Eric?
We have a special guest here. Sit down.
Oh my gosh.
All right. So actually Eric will help us do this. Look at this.
What's up, Eric? Roger, how are you?
Hey, I'm doing well. Sorry, I didn't have this mic on. I didn't know that, y'all were still talking.
Yeah,
so
we're actually doing Q&A now.
Yeah.
So
you want to
pro-motility.
introduce your friend so you can properly give us context of who this handsome guy is?
I kind of assume, everywhere he goes, he's pretty much a celebrity. So I guess if nobody recognizes him, but once I say it, you'll be like, oh, I recognize the voice. To my left right here is the very handsome, very intelligent, and co-host of the Gut Check Project, Mr. Eric Rieger.
I'm really just a valet. I professionally park vehicles. I appreciate it.
Yeah, that's probably where you've seen him before. If you've ever parked a vehicle.
Are you really an anesthesiologist?
Oh, I'm sorry, what?
Are you an anesthesiologist?
Yeah, anesthesia provider. Yeah, I'm a CRNA.
Okay. All right. Thank you. Just needed
Yeah.
some context here.
Yeah.
So he is a medical provider. Eric and I actually, that's how we met way back in the day. He was putting my patients to sleep and we would talk, and now he is doing his anesthesia thing, doing the podcast, and over at KBS with Atrantil. So we essentially run in the same circles and bump into each other all the time. Like he'll just randomly, if he hears my voice, he just walks in a room. He gives, he doesn't care.
I could sense it.
Yeah.
Okay, back to the Motegrity and the precalipride and all of that, because we're going to run out of time with all the questions. Go.
Yes. So I do. And it's all about that migrating motor complex, but it's also all about making sure you get proper sleep. So I try to make sure that, so my patients, if I had my, if I could get everybody on the same regimen, it would be, you know, taking something to help with anxiety so that you're not going to sleep anxious. It would be help to get into a deeper sleep. I try to use Motegrity if insurance pays for it right now. That seems to be my go-to. I'm in the process of trying to figure out some different natural motility agents. I have not had a whole lot of success with the typical ones that are out there, ginger and things like that. I just haven't seen that in my patients. And that being said, I tend to have people that have failed everything. So I kind of have I feel like if I can figure out combos, which is why our box is so exciting, because we get to play with that. Cool. I told her about the launch of the box.
Yeah, nice.
Yeah.
Nice.
Couple of questions. You were saying that you couldn't get the erythromycin in the dosage you want. So I know people just cut the pill into 4s.
I was doing, so I really liked the ethyl succinate liquid. And so that way the liquid actually gets absorbed in a totally different manner. Once again, getting back to the fact that you have to play into that gastroparesis aspect, that if you're bloated, your stomach may not empty. I need to assume that you're not going to have that same response. So I need to get that medication across the pylorus where it's at. Okay. Once again, talking about how I look at breath tests and say, well, how would I manage the Atrantil on this one? So, all right, next question goes to Eric.
Okay.
I'll curious if any food changes were implemented as part of your POC. Pamela Cook is wondering.
Food changes in point of care? Is that what we're talking about?
That's it. Yeah. Like, what kind of diet do you all suggest?
So, well, really, I would say the people that we encounter are probably up for some type of dietary coaching anyhow. And I would say that, like any supplement, Atrantil, although a very powerful supplement, is exactly that. So consuming polyphenols throughout your daily diet is always highly suggested, as well as, taking into consideration the sources of those, which would be berries, colorful fruits, colorful vegetables. Have you already covered this?
A little bit. Yeah, we already talked about polyphenols.
But animal protein is a big plus for us. You certainly need your vitamin B, and there's really no better source than that. And then, it's more or less cutting out the trigger foods that probably some would have. If you recognize it happens to be bread, then probably don't eat bread. But then, of course, it kind of depends on the type of bread. We know people who are highly gluten sensitive, but they happen to have really good luck with heirloom sourdough bread, but that's probably not everyone. So I guess it more or less kind of depends upon where the catalysts are that send somebody into a.
I would say
it's a trick question. Let's face it.
Yeah. So
everybody's different.
Yeah. So basically all I do is I don't get extreme.
Yeah.
I actually don't even say FODMAP. I actually don't say elemental. I don't do that. I just go, please quit opening any of your food. Yeah. Make sure that it's not in a package. And personally, I believe that gluten is the gliadin is inflammatory. So I say, let's try and avoid gluten and don't eat any processed foods. I don't get into the extreme, the other diets, and I call them all extreme because if you stay on them long enough, you will have micronutrient deficiency.
That sounds pretty good too.
Yeah, I'm moving on. Lynn, I'm one of those methane producers for whom Atrantil has been a miracle. It helped me from day one. I may never be cured of SIBO-SIFO, but I can live with this now. Thank you so much, Dr. Brown. You've greatly improved the quality of my life. Yay. Do you guys ship to Canada for Atrantil?
Yes.
We sell in Canada now. We actually have our own NDN. So we are certified for full distribution within Canada through Canada Health. Absolutely.
Oh, awesome. So if they order through my link, can they get it in Canada?
They should be able to.
Okay.
Yeah.
Okay. And when do you use Pro versus Atrantil? What is Atrantil Pro?
Okay. So Atrantil Pro is something that we came out with for healthcare providers. And it all came about because we were having dinner with Kiran Krishnan at the IFM, and we were sitting there talking over a few glasses of wine, and he went, whoa, wait a minute. He goes, I really think that we can collaborate on this. And we spent some time with his microbiologists, and they put together a proprietary blend of 3 spore-based biotics that, as it turns out, we thought that we were just going to use those spore biotics that already have some anti-inflammatory effects, that already have some improving microbial diversity, improving antibiotic diarrhea, mixed with our polyphenols, which were also shown to do the same things, improve microbial diversity, decrease inflammatory markers. But as it turns out, and he didn't even realize this when he said it, because now we've met with other scientists, those particular ones, Bacillus subtilis, Bacillus clausii, and Bacillus coagulans, have enzymes in them called tannases. So they live in the soil, they live with plants, Mother Nature knows what she's doing. They can actually help to break down the large polyphenols in Atrantil. So in the talk, when I was just showing that you have to have the right microbiome, it's a little bit of a biohack. So what we're finding is that if you have diarrhea, it seems to really help with that because of the spore-based biotics. But those people that have a harder time with Atrantil, and what I'm doing in my practice is, if you have symptoms of SIBO or IMO, you go on Atrantil on the high dose, because we know that makes a difference, possibly high dose for longer. And considering that the Atrantil Pro would be more of a daily thing, you just got done doing the
dietitians conference.
The dietitians conference. And so what were you telling them about when to use Atrantil?
I mean, it mirrors basically what Ken said. The larger differences, I guess, just to kind of put it succinctly, was Atrantil is great for someone who has just bloating or trigger food bloating. If they happen to have SIBO, you definitely want to start with regular Atrantil and high dose. Where someone may want to start with Pro is, it just as Ken said, if they have difficulty taking polyphenols, then they probably don't have the right microbiome to break it down. Mm-hmm. And then beyond that would be somebody who has chronic diarrhea or dysbiosis, someone who's known that they've been diagnosed with chronic dysbiosis, which often correlates with someone who's recently taken a very powerful antibiotic recently. So there's that level of delineation between the two. And then I think that over time, what we'll see is, even if someone starts with Pro, they'll probably still migrate back to Atrantil to kind of finish the job.
Okay. We're going to go for about 5 more minutes. Do you need to eat before taking Atrantil? How much with each meal?
No, you don't need to eat. I take it all the time on an empty stomach. When we first launched, we found that some people seem to be sensitive taking anything on an empty stomach. And we had fewer call-ins when people took it with food. So my suggestion is to take it with food in the beginning, see how you do.
Okay.
I take it all the time.
And you can take it with other things like your nutribiotics, calcium glucarate, and digestymes and all that. Yeah, no problem.
Yeah, you can take it with that. Just the one caveat that I tell everybody, because it's not been studied. Yeah, the one caveat are these narrow therapeutic window pharmaceuticals. So if you're on an anti-rejection medication, if you're on an antiarrhythmic or an anticoagulant, probably a good idea to separate them just in case.
So Terry
and thyroid.
I have a kidney transplant patient that has chronic nausea, vomiting. I bet he has SIBO. Test, don't guess. Can I use Atrantil with transplant patients?
In that same caveat, if you're on anti-rejection medications, I would discuss it with your nephrologist and say, listen, I really want to feel better with this. I'm shocked at how many patients show up that are on medications like that. I'm like, oh, did you discuss this? Because, it's over the counter. But in a case like that, the risks are so great that if you were to have a rejection, my suggestion is discuss it. I would be, and by the way, whoever that is, if your nephrologist wants to call and talk, that's one of the things that I do a ton of, is I have doctors reach out to me and go, what is this? My patient wants this. And then when I explain it, they're usually like, oh, that sounds great. Yeah, they're fine. So usually, but as long as it's being monitored.
Okay. Can you take Atrantil long-term?
Oh, yeah, I have since 2015, pretty much every day.
So based on the talk that I just gave about microbial diversity and protecting your brain, and that 83-year-old woman who I could probably call right now and she'll hop on a plane and jump down. These are all, she's a good 8-year user on a regular basis. And so, yes, you can not only take it, it probably keeps working better because of that microbial diversity.
Okay. And does it come in a liquid?
No.
Not yet.
We've actually dabbled in this, and it is unpalatable because it is completely unpalatable. So no,
we've got 2 truckloads of Atrantil soda pop that nobody really wants.
Yeah. And we've actually, because I get this a lot because of people with children with special needs and stuff. And unfortunately, I wish we could, it's just, maybe we'll figure it out. Maybe there's a food scientist that'll know how to do it.
We've not given up, but it's not yet.
Don't give up. And I want no one here on this call to give up. I also, Christopher's asking about the breath. These are from Kiran Krishnan and from Microbiome Labs. It's the enzymatic mouth lozenge that actually works on your breath. So you want to go, Clarissa, can you pop that link to how you can order with 15% off from Microbiome Labs? This is new.
Cool.
So cool.
Wow, that's awesome.
So cool.
We love ourselves some Kiran Krishnan. Yeah. So he's one of our favorite people.
Brilliant dude.
Yeah.
So Megaspore is definitely something for you to explore. For those of you who are asking about probiotics and prebiotics, etc. Okay, here we go. Thank you. You're welcome. Okay, pop some love into the chat for these 2 characters. Dr. Brown, Eric, thank you so much for
all you, Shivan.
All your good works. Really, really tremendous to have you here. Thanks for the continued discount. I appreciate it. Our community appreciates it. It's the best price anywhere on Atrantil. Load up. That's the back. Here's the front. Like, I've been using this so much, I lost my lid. Really, seriously. And then No Bloat 15 gives you 15% off at Microbiome Labs for your prebiotic, your probiotic, your breath lozenges. And Dr. Brown, do you see people for consultations online?
There's some Texas laws and insurance companies and stuff I still see through insurance. So the short answer is kind of no. Okay. Right now, just because of some legal issues in the group that I'm with and whatnot. So, but we do love, just like you, I do love comments. Check out our podcast, The Gut Check Project. Go to KBMD Health if you want to interact with us. And of course, any questions that you ask, they end up coming to me. If you order through Shivan, get your Atrantil, and then you end up having to contact where Atrantil is at, and you talk to this wonderful person named Dacia, she'll find me and give you an answer. So I do, basically I'm saying we do tons of indirect consultations that are not on a formal way. So.
Okay. By the way, just a couple of questions about prokinetics, guys. You need to be on those daily after your treatment. So don't just a couple of times a week it. Right? I left that part out. So I treat during, and I leave them on for 3 months minimum after a full treatment. And we're talking treatment with Xifaxan, neomycin, Atrantil, Motegrity at night. They stay on the Motegrity for 3 months. Yeah. This is not the time to just be sporadic with your prokinetic, because you need that migrating motor complex constantly doing its thing and sweeping. So I needed to have prokinetics, but not daily. Tisha, that makes me nervous. Please get on that. No. I would actually do that. I would actually do that daily. And especially if we have these ones that are relatively safe and easy. And if I'm going to crack the code and figure out like a real natural one that uses some of the mechanisms. That'd be awesome. All right, we're going to wrap up. Thank you, gentlemen. Thank you, Clarissa, behind the scenes. Thanks everyone for attending. We will send out the replay. We'll send you some links, etc., so you can get some more of your resources, and be sure to watch this over again and check out the Gut Check Project on YouTube so you can see these 2 continue to enlighten us all. Thanks so much, guys.
Thanks,
Siobhan.
Thank you. Bye.